Across Newcastle and the Hunter, 2NURFM 103.7. He is back. Stop waving at the video camera, Mark Goswell.
I like it. I did my hair.
Yeah, well, that would take 1 second.
No, it takes a bit longer to shave it than to do it.
Fair point. All right, so our exercise physiologist, Mark Goswell, is back, and you've got, we're sort of going to go to the lower back, the bum area, but
Yes.
kind of a bit of a ghost disease today.
Yes, the sacroiliac joint. Or SIJ.
No need for language.
I know, you get confused with all these big words at times.
It makes you sound smart,
It does. I always like to throw in big words to pretend that I sound smarter than what I am.
like it and. All right, go back to this
sacroiliac joint. So I've had a run of these over the early this week and also last week with a couple of clients coming in. And it's one of those things in terms of lower back injuries that is mismanaged, misdiagnosed, mistreated, and just generally missed. One of the main reasons for that is, an MRI won't show it, a X-ray won't show it, a bone scan will show some inflammation into the area but not really describe what's going on. So it's sort of the silent killer of low back pain. And a lot of the clients that will come in have had this 1 to 2 year journey where they've had some investigations, it doesn't show anything. It's basically causes this gnawing pain into the left or right hip and point specific into the lumpy bit that you can feel down in your lower back, which is that connection of where the sacrum and the ilium join.
So it's not your bum, the lumpy bit.
Not the bum, the lumpy bit, the bony,
the bone bit.
The bony innominate.
Gotcha.
Another big word.
All right. So you said a lot of folks have had some investigations. I'm guessing that's what, some scans, etc.
Yeah, so MRIs, X-rays, and it sort of doesn't show anything. And then you obviously get down that path of what we're talking about last week with going into that pain science, and people start challenging the person in terms of where they're at, and it really does start to mess with their head. And a lot of the time it's just that it's one of those things, not a lot of people are 100% aware of it, and that just kind of gets mismanaged and mistreated. But it really mucks with their head in a big way.
All right. So if you've gone through the scans and they just come up a nice, pretty picture with nothing there, what are some steps that people can go through to either check this box or eliminate it?
Yeah, look, we have really good success with osteopaths in terms of the hands-on treatment side of things. But from an exercise physiology perspective, because usually this has gone on for extended periods of time, they have significant weakness within the gluteus maximus and the gluteus medius.
That's the bum for all of the normal people out there.
That is all the bum, yes, and the bottom, and getting buns of steel. So, we can certainly help in that respect.
Or steel wool.
But look, it's one of those things where you need to get the right treatment and the right management in terms of getting that SIJ put into alignment. But anyone out there that's got that gnawing hip pain, doesn't matter how much you stretch, how much you deal with it, how much you try to do some conservative management, if you haven't been down the right path, that you need to get that right direction and that right guidance.
All right, a couple of things to think about there. If you've had that lower back pain that just won't go away and won't scan, just quickly again, Mark, the name of the sac thing.
Sacroiliac joint.
Spell it.
SACROILLIAC joint.
WTF, fair enough. Sounds good. All right, Mark, we'll catch you next week. Have a great one.
Mate, always a pleasure.
Our exercise physiologist with the bum and the lower back on his mind today.
All about the butt.
At 2NURFM.
2NURFM, a broadcast service of the University of Newcastle.